And third paper will be on learning styles of nursing and midwifery undergraduates of the University of Peradeniya, Sri Lanka, utilizing the KOLB learning style inventory. The authors are RDUP Sugathapala, SMSP Siriwardhana and TMSUB Tennakoon from the Department of Nursing and Midwifery, Faculty of Allied Health Sciences, General Surgeon Kothalaval Defence University, and the Department of Nursing, Faculty of Allied Health Sciences, University of Peradeniya, and the Department of Community Medicine, Faculty of Medicine, Peradeniya. The paper will be read by RDUP Sugathapala.
Well, very good morning for all of you. And I'm going to present my research findings on learning styles of nursing and midwifery undergraduates of University of Peradeniya, utilizing the KOLB learning style inventory. David KOLB was an American educational theorist. Defined learning is the process whereby knowledge is created through the transformation of experience. Learning styles are the way individuals concentrate on, absorb and retain new or different information or skills. Learning style of a person is influenced by many factors such as age, gender, socioeconomic background, etc. If students' learning style is known, academics could anticipate their students' preferences, take advantage of their strengths and avoid their weaknesses. The learning style inventory is a simple self-description test based on experiential learning cycle. There are 4 stages of this experiential learning cycle. The first stage is concrete experience, which consists of learning by feelings or reactions to new experiences. The next stage is reflective observation, that is learning by watching and thinking. Then it leads to abstract conceptualization, making some theory or models depending on what was observed. And finally, stage is active experimentation, that means learning by doing. So depending on these 4 learning cycles, KOLB defined 4 learning styles: concrete, accommodator, converger, diverger and assimilator. Converger, characterized by active experimentation and abstract conceptualization. They prefer practical application of knowledge. Divergers, characterized by concrete experience and reflective observation. They prefer watching rather than taking an action. Assimilators, characterized by abstract conceptualization and reflective observation, and they are really on the theories basically. And the accommodators, characterized by concrete experience and active experimentation, and they mostly hands-on experience, and they set tasks and actively engage in work. So our question is, what would be the learning styles of nursing undergraduates of University of Peradeniya? So under that, specific objectives to describe the learning styles of BSc Nursing undergraduates of University of Peradeniya, and to describe learning style preferences according to the gender of the above undergraduates, and to describe the learning style preference according to the academic year of the above undergraduates, and to examine the influence of parents' education and occupation on learning styles. So this was a descriptive cross-sectional study conducted at University of Peradeniya. The study population involved all undergraduate nursing students in University of Peradeniya. In the year 2012, the total number of students was 144. So the all students was taken as the sample because of the reduced number of students. The study instrument was self-administered questionnaire, which consisted of socio-demographic questions to find out the parents' occupation and the occupational level, and the KOLB learning style inventory to find out the learning styles. A pre-test was done on 10 students to clarify the questionnaire, and the reliability and validity of the questionnaire was checked. So to fill the questionnaire, it took less than 10 minutes for each individual, and data were analyzed using SPSS program. So these are the results. Frequency distribution of students according to their gender. The results reveal that from the total of 120 participants in this study, majority were females and only 25.8% were male students. The study revealed that the predominant learning style was convergent and accommodator compared to the divergent and assimilator, and depending on the gender of the participants, male students most predominant learning style was converging learning style, and female students accommodating. Distribution of learning styles according to the academic year of the participant shows the first year and second year students are mainly convergers, and when it comes to the fourth year students, they are mostly the accommodators. So this table shows you the distribution of student learning style with their parents' education, and there was no significant relationship between the parents' education level and the learning style preference. And similarly, a significant relationship was not found between the parents' occupation and learning styles preference in this study. So when it comes to the discussion, the majority of nursing students were convergers and accommodators in this study. So that means they prefer a practical application of knowledge, as well as they are actively working the settings. Maybe they are, from the very beginning, our students are placed into the clinical placements. And most male students had convergent learning style, while the female dominant learning style was accommodating. And a similar study that was done in Iran is revealed that the convergers and assimilators were predominant among the nursing and midwifery students. So when it comes to the academic year, the predominant learning style among the first and second year students were converging, while the accommodators are mostly, while the fourth year undergraduates are mostly accommodators. That is because they when it comes to the fourth year, many critical thinking skills has to be developed, and maybe they are actively engaged in practical work. So the significant relationship was not found between the learning styles and parents' educational level. Similarly, there was no significant relationship between the learning styles and parents' occupational status, and it could be influenced by other factors such as hypermedia-based learning or cultural influences. So in conclusion, it is suggested that teachers should consider the learning styles of their students and adapt teaching methods to fit students' learning styles. So this research can further be extended to find out other factors associated with learning style preference. I would like to acknowledge the subjects involved in this study for their cooperation, and Dr. TMSUB Tennakoon for his supervision throughout this study, and all the staff members of the Department of Nursing, University of Peradeniya, for their valuable contribution and support. And these are the references. And thank you very much for attending my presentation. Thank you.
Did you correct for the gender split in the different years? Perhaps I should rephrase it. You compared the first, second, third and fourth year of students as a variable. Did you look at the number of males and females in each year? Was it different? And did you correct for that in your analysis?
Yes. Depending on the academic year, we observed
Thank you.
In which language did you administer the questionnaires? In English. So, did you look at the culture specificity whether it is now you did not validate it, did you? So was it were there any things which would be affected by the difference in the cultures?
Validated before by anybody?
So the KOLB learning style inventory is already validated questionnaire.
Is it validated for Sri Lankan students or in Sri Lanka?
Nobody validated it.
Right, okay. I think that's what Dr. Balasuri. Of course, you haven't done it in the study. You haven't mentioned in the study, but I'm just curious. Have you got the actual performance of the students available to you to see whether the different learning style students do differently in exams? You don't have that. So if it's an ongoing study, that's something worth looking at.
Yes. Thank you.
Okay, thank you. In the absence of further questions, we'll move on.